Good afternoon, everybody. We're just about to start. Um, we have a special guest today. Uh, there we go. Doc Ivy finally was able to get in. Technical difficulties as usual. Good afternoon, everybody.
Good afternoon.
Afternoon.
Ye- Yes. Hi. Thank you so much for joining us again this afternoon. I'm Dr. Ivy, and he's Dr. Gills. Along with us is Dr. Gama, our lead veterinarian from Dumaguete City. So this
Hello.
afternoon, yeah, hi, Doc Gama. This afternoon, we will discuss about. Dun, 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 dun.
Dun, dun, dun. Had to stray. There we
You
go.
are what you eat.
So
Okay.
this is a special topic, especially now that most of us are home. We get to notice what our pets are eating more often. And sometimes I think we're all a little guilty of giving them something from the table when they give us this look.
Yes. Okay. So they're excited for every morsel that drops, right? So
Yes.
what
Hopefully
sh-
not this big.
yeah, what should we feed our pets? This is a very nice discussion this afternoon because a lot of us are curious. What's the best food to give our pet?
So dogs are more omnivorous than cats. What does being more omnivorous mean? So dogs can eat vegetables. They should have a little bit of vegetables. They should have grain. They can have a little bit of protein from fish, protein from chicken, and other sources. Cats are obligate carnivores, so they can only eat meat and fish and other protein sources, animal protein.
Yes, it's difficult for us to make our cats vegetarian because they will be very malnourished. This for us, na, if you look at our teeth, we have the sharp and also the flat teeth because we are omnivores. If you look at the cow, they only have the flat teeth because they are herbivores. While the cats, if you look at their teeth, it's mostly sharp because they are carnivores. So aside from feeding meat and other source of animal protein for our cats, hold on, that's noisy, no? For our cats, we also give them taurine. So taurine, it's not available in the fish that we give. It's mostly available in the cat food. But then, if you're giving fish or the home prepared diet for your cat, you may add a little taurine to their diet. The taurine is most special for them because it helps in the cell development of their heart, their joints, their skin, basically the entire cat. Okay, Dr. Gills, we would also like to discuss about our very first slide, right?
Yes, the giant pork chop that we somebody gave this lucky dog. But you have to be careful in giving raw diets. In fact, they're not recommended anymore
Mm-hmm.
because of the health hazard that it poses to uh, the pet owners.
Mm-hmm. The uncooked meat can be a source of salmonella uh, for for us pet owners, and not only that. Lately, they found out because before during the early 2000, what they mentioned. Hold on, this is really funny. Early 2000 was that they mentioned that our pets are like their forefathers that would forage and eat live animals and will eat the gut system and it makes them really healthy. But later on no, because science has been improving a lot, what they realized was that our pets are more, their stomach is more like us. The food that we eat is basically almost exactly the nutrition and the diet that they also need more than their forefathers needed before. So right now, if you want to give a table food for your pets, we will always recommend for you to heat them and then cook them for safety. Okay.
Yes, always prepare for your dog. But
Yeah.
we'll be discussing that a little bit later as well.
Mm-hmm.
So going back. So your dog's diet or cat's diet, your pet's diet, should depend on three things. One is the age of your pet. Secondly is the level of activity. And thirdly is medical predisposition. So meaning what likely diseases is your pet going to have because of the breed or the species, and we will be discussing more in detail. So age of the pet. So puppies, they need more protein because the animal is growing up. So they're developing all their body systems, they're multiplying their mass and size. It is also usually more digestible because the younger animals have a more sensitive GI tract, no? So it has to be easily digested and usually it has to be tasty.
Yep. Since their microflora is still developing, kaya it needs to be digestible. Not only that, we also need to give it more. No, instead of giving it twice or once a day, we give our for the dogs, we give it 3 to 4 times a day because they have smaller stomach. They also need to replenish that, especially with their activity. Also, they are relatively hyper. For kittens, though, for cats, they are picky, so they would go back and forth. They do not feed a big amount at once. Okay, so they can eat more times than puppies do. Okay, Dr. Gills, let's proceed.
So the level of activity. More active dogs require more food because they use the energy during exercise or working dogs or dogs that you take jogging more so than compared to dogs that are meant to be relaxed most of the time, like Shih Tzus and other dogs. And they tend to be much more laid back. So the more activity your dog has, the more often it needs to be fed. Also, the reverse is true for dogs that are much more laid back. So for medical considerations, the shape of the jaw, specifically for short snout breeds like Shih Tzus and Bulldogs, wherein they have an underbite or an overbite, they may not be able to chew the pellets properly. The other thing would be the size of the pellets. You don't want to feed tiny pellets to a Great Dane or giant pellets to a teacup Chihuahua. Also, um, these dogs with special medical considerations are usually less active, so that the calorie count also has to be uh, in proportion to this.
Okay, in connection with that, like what Doc Gills mentioned, no? There are also dog food that are for smaller breed. There are dog food, the sizes of the pellets are for larger breed because these large breed dogs, if you can see, once you feed, no, and if they're in good condition, within a minute or two, hurot na ang food, right? Or they just finish the food right away. But then, if they eat no, if they eat the smaller size pellet, it might go to the wrong hole because paspas kaayo, no, they feed too fast. That mura ba siya and then that's it. They're done. So they need the bigger pellet so that they will digest it because large breed or the deep chested dogs are also prone to GDV or gastric dilatation and volvulus. So feeding too fast is not good for them. They need to chew their food. Okay.
Doc Gam, what do you see more in Dumaguete? Do we see large breeds or small breeds?
Yeah, most of our patients here in Dumaguete Doc is more of small breeds. We have a few large breeds that includes Labrador Retrievers, German Shepherds, and for smaller breeds, it would include like Shih Tzu, which is there are lots of those
May
breeds
change na
here
day, Doc
in
Gams,
Dumaguete
no?
City.
Compared to 5 years ago, mas daghan ang large breed.
Mm.
Um, yeah, so far, Doc, I think maybe this year there's a minimal
Large feed.
amount of a number of large feed because of our recent
Sakto sad.
situation as well with the COVID
Yeah,
thing. Yeah.
that's good to know.
So, what should you look for in a diet? For my pet, the best way to determine exactly what diet best suits your pet will be to talk to your veterinarian, because you have to deal with the individual, not just the dog. So it can be a highly active Shih Tzu or a very inactive Labrador, depending on the situation. So your veterinarian will be able to help you to make that decision as to not only what dog food to give what food to give your pet, but the amount to give your pet as well.
That's very true. So, if you want, napapaso na rin ako, nakakagaya pala. So, the better ingredients, the better the pet food. If you want to prepare your pet's diet, then make sure that it is specific for them. Okay, for the dogs, you want to add protein, carbs, and fiber. For cats, you want to give more of the fish or shrimp or chicken or animal-based protein and add taurine. This one, no, I will repeat that again. The better the ingredients, the better the pet food. That's why if you have a very busy lifestyle or you don't want to prepare every time your pet eats, you buy a bag of food or a can of food from the store or from your vet. Okay, the more expensive the pet food are, the more that the ingredients are already for human grade consumption. Again, if they are cheaper, it also means that the proteins that they put there are not that of good quality anymore. Okay, so they may already include the hoof, the hair, the parts that we do not eat as individuals or as humans.
I remember when one of the dog food companies made us try their canned food. You remember that, Doc Ivy?
Yes, murag dili na ko matulon because they were asking us to try the pet food. But when we tried it, it's actually not bad. Okay, with pet food, especially for dogs. Again, we will repeat this one. They follow their nose. Langhap, sarap. The smellier it is, then the more palatable it is for our pets, or the more not palatable, because when you say palatable is that they can taste it. The more acceptable it is. That's why sometimes when your pet food does not smell a lot, no, even if it's good quality, your pet will wait for a while until it's very hungry before it starts eating the food because they cannot really smell it. Okay, this pet food most of the time it does not have any salt, so ano lang siya, humot lang siya.
Mm. And one of the biggest problems when your dog has a cold or a cough and they cannot smell the food is usually they lose their appetite,
Mm-hmm.
like Doc Ivy was mentioning.
Yeah. The right amount of calorie for your pet is most important. They are like us. Like sometimes it's nice to eat lechon, crispy pata, lechon kawali all at once, no? And then after of a while, we feel bloated because we might have eaten 1 week's worth of calorie in our one meal. So it means that we need to make sure that the calorie intake that we have for our pets is just enough for what they need for that day. So if again we have a hyperactive dog or dogs that we use for agility, they need more calories than the dogs or the cats that would just sleep the entire day in your couch, no, and not moving a lot. So that's what we need. We say by this one, right amount of calories.
Yes, Doc Gamma, what have you noticed in the amount of food that you have to feed your dog or your patients when it comes to the higher quality pet foods? What is the usual reaction from the client?
Sorry, Doc. Can you repeat that again, Doc? Because
Here,
I cannot really. I think my line is a bit bad.
What have you noticed in the higher quality dog foods or cat foods that the reactions of your patients, your clients are when you give them the amount to give?
Yeah, with patients that we've provided with good quality food, doc, results of our patients receiving that is really good. Like they have a beautiful skin, they tend to become they're more healthy compared to dogs receiving lesser chance for them to develop diseases as well.
Yeah, and then they only need a small amount, right, Doc Gamma?
Yes, doc, they
So
need smaller amounts. True.
yeah, so even if the pet food is relatively on the expensive side, but then if we compute the right amount for that pet, then it comes out that that pet food becomes practical. Okay,
Mm,
do not go beyond. If not, these pets will be fatter. Okay.
true.
How much food should I feed?
How much? So if you look at the back of your pet food, then you will notice that there is usually the recommended amount to feed, no? Especially if it's it will always depend on their weight, it will depend on their age as well. Or if we feed them with a prepared human food, then please check the estimated size of their stomach. We might give them this much, but then our pet is also this big. Okay. So that's over. Their stomach is only a small portion of their body. Okay. Or sometimes too, we might give them this small and then they're this big. So they become undernourished. So feed according to weight, and this must be monitored. And this is not always practical. How do you, can you elaborate on this, Dr. Gills?
Well, especially now during these times, the best thing to do the to monitor the weight loss or if your pet is at its ideal weight is through your veterinarian. And unfortunately, going out at these times is not that practical. So it is best to communicate with your vet and monitor the exact um, weight of your pet so that your pet doesn't become too thin or doesn't gain weight too quickly.
That's good. Good to know.
So we have a couple of questions. I'll put them up on screen. Here we go. What ideal dog food brand that will not cause constipation? Would you like to take this, Doc Ivy?
What ideal dog food brand that will not cause constipation? Oh my God. Um, I cannot
Okay.
say any dog food for now, but definitely there are dog food, the prescription diet that has higher fiber that will help them avoid their bowel better than a regular diet. Okay, so ideal dog food brand. Um, we do not want to say any ideal dog food brand for now. It's better for
It's
you
not
to
it's not only about the dog food.
yeah,
Constipation can be a multifocal problem.
yeah.
So it might be that your dog is not drinking enough. It might be that your dog, like Doc Ivy said, requires more fiber in its diet. It might be that your dog has, if it's a male, it might have problems with the prostate. So it's not just about the dog food. It's something that you need to have it have a consultation, so to say, to discuss with your veterinarian and check what exactly is going on. There are several options on the market that can help, and most will not cause constipation um, as long as other factors are not present.
Okay, Dr. Gills and Dr. Gamma, we are not okay. What we have in our clinics, we carry two brands that are relatively that naging honest na, no, that are relatively on the good side, or they are good quality. The Hill Science Diet and the Royal Canin. We believe in these brands, and then we think that if you want to try, then it can help your pet. This also goes for the next question: what pet food is good for skin and for shiny hair for a very active Chihuahua? So for a very active Chihuahua, you may give the for small breed of this brands. No.
Yes, an active Chihuahua. Usually, you also need to make sure that you're giving enough calories. If they're very active, like you say, they might not be getting enough in order to fully um, bring out the luster in the skin, so to say.
Okay.
Okay, one last
Okay.
interesting question before we proceed. Would you recommend freeze dried or air dried dog food to puppies? Do we have this kind of dog food?
Oh, I can see Dr. Gamma there also. Okay. Freeze dried or air dried dog food to puppies. Actually, here in the Philippines, I'm not sure if we have freeze dried or dried dog food. What we encountered are just the treats for this. These are also relatively they are processed in a way that they get rid of the bacteria, etc. As long as it's good quality, no, then I don't think it's going to be a problem.
And the salt content as well.
Yeah,
Yeah,
that's
so
all.
that's the two biggest factors that would concern me regarding those two, uh, freeze dried and air dried.
Thank you, Miss Pa, for your question, and Miss Arcania. Okay. Dry or canned? Oh, this is a nice
Yes.
question. Doc Dama, dry or canned?
Actually, look, it just depends on what the dog likes.
Yes.
Right, so some pets would love to get dry food. Some pets do also like wet foods. So
Okay.
it
So let's
depends.
discuss so that our audience can decide what they want. For canned food, Dr. Gills, would you like me to proceed?
Yes, please. Go ahead.
Okay. Um, for canned food, they are more palatable and easier to eat. They have fewer carbs and much less preservative. And they also have less artificial flavorings. And the only downside is that they spoil quicker. And sometimes, too, if you look at the bottom of the can, you will also notice that the expiry is not as long as from the time that it was produced. It's because of all these reasons. No? While, on the other hand, the dry pellets. This helps with dental health and more convenient to give. You just pour it and you don't need to keep it in the refrigerator. And usually, if you compute this by weight, this comes out cheaper than the canned food. It also helps with the dental health, not because once they start chewing, the chewing actually acts as a brushing effect for our pets. So it helps them lessen their calculi in the mouth.
So the pellets, a lot of people wet the pellets in order to make it easier for your dog to chew. And this eliminates the process that Dr. Ivy was just mentioning, that the pellets perform cleaning in a physical manner. So they have to be hard in order for the tartar to be scraped off the tooth.
Okay.
Now, as far as I understand it, I know we have a new diet that also has nutritional components that help not build up tartar. But I think we'll be discussing that a little bit later, correct, Doc Ramo?
Yes, but we will be discussing with this diet later, and we have surprises that surely you would like to get as
Amazing
well.
surprises, right, Doc?
Yes, doc.
Yeah. Before we proceed with Doc Gamma, there are a couple more questions that I think are interesting. Um, are probiotics ideal or passable for cats? We have tried it for a month and their excretions are not as pink. Yes, cat poop is one of the most odorous things in the world. The problem with cats is they are very, very particular about what they like to eat. And if your cat accepts it, probiotics have been more and more being proven very beneficial for pets. So much so that the biome of the gut biome, is being studied in order to help uh, prevent and cure certain diseases.
It's true. Again, if they eat good quality cat food, the smell of the cat poop is not that stinky.
And one more, okay, more. I know a lot of people who feed their pets bones. What would you advise them? Mm.
Okay, that's a very nice question. Feeding them bones also helps with chewing effect, no, that can help their teeth. The thing is that there are some dogs that might swallow the pet food in bigger chunks, and I know not the pet food, but the
Bone.
bone in bigger chunks, and those bigger chunks cannot be digested by the pet. So sometimes they can have indigestion. In worst cases, they can have obstruction, which might need surgery. So if your pet is not used to eating bones, then we would recommend for you not to give the bones. Or if you do give the bones, give the softer ones that are easier to digest than the hard bones.
Or
Um,
the big ones, wherein it cannot fit in their mouth and they have to chew on it so
mhm.
that they do the physical brushing of teeth.
Yeah. Okay.
It's either or. We cannot recommend feeding bones per se because it depends on your individual pet, like the Ivy was saying.
Yeah.
So this is a follow-up question. What specific part of bone? I think we answered that already.
Or this one, if you're giving the big one, bulalo, no? You give the part where the soft bone is, kato galing nakaano sa ilaha, the ball of the socket, no? So that's a softer part, and the rest of that bone is already the hard part. If you give chicken bone, you give the flat bones more than the long bones. Or the long bones, the drumstick, the soft bones towards the cartilage, no, in the chest area. Welcome, Miss Sels. Okay, I hope that
Again,
answers
we
the show.
cannot recommend you giving bones to your pet. Just
Yeah,
to clarify. So now comes the i-
interesting part
interesting part of the
discussion.
discussion, wherein Doc Gamma will be sharing some cases we've seen in the clinic in Dumaguete. So please take it away, Doc Gamma.
Okay, thank you so much, Doc. So let me just prepare my slides. Here you go. Can the viewers see it already? Okay naman, Doc, no?
Yes, the clams.
Yeah. Okay. So once again, by the way, I'm again Dr. Gama from Animal Wellness Dumaguete. Animal Wellness Dumaguete is actually located in Hibard Avenue, Quiapi, Dumaguete City, just right across Nevas Pizza. Um,
Really near Siliman University, right, the clams?
yes, Doc. Just a few meters away, so they can just come over.
And we have ample parking.
That's true. That's true. Yeah. So everyone is welcome here to bring your pets. Yeah. So without further ado, um, I'll be showing you actual cases here that we have here in Animal Wellness Sumaguete. But before anything else, I'd like to inform you that I might be showing you some photos that you might not like. I'll just skip it as fast as I can, especially if you're eating. I just would like to extend my apologies ahead. So,
Yeah, sensitive
um,
content.
Sorry, we are veterinarians, but for others, this are already not good.
I just make it fast, doc, so that they won't feel bad.
Yes, Doc.
All right. So for the first case is Oscar with dietary indiscretion. So dietary indiscretion is basically a type of condition in dogs and cats wherein they develop diarrhea. Sometimes they do have vomiting, sometimes not, and this is due to the sudden change of diet. sudden change of diet, or even with treats, treats can also lead to this dietary indiscretion. So with regards to this case, it's an 8-month-old dog having diarrhea for 2 days, has been on human and dog food mixed food, has been given with treats as well. And actually, this dog is free roaming, causing the dog to scavenge maybe dirty food or spoiled food, maybe in their garbages or somewhere. So next photo will be the poop. So as you can see, the poop was wet. And then I'm sorry for that, but anyway,
Very fast.
I have to make it very fast. Later on, you'll see much better poop. This next photos are normal poop, normal poops of dogs, which would occur, which happened like after we gave this specific treatment with probiotics and diet change. So these are, I just make it fast. It's now firm and with firm consistency. I'm very, very sorry, guys.
So, Doc Gams, it's like from water to chalk. No?
Yes, yes, Doc. And actually, that's the ideal poop, as far as I know, because it should be formed. Yeah,
Yes.
yeah. So yeah, I think we'll stop with the poop now. I go with the other case.
Especially for those who are having snacks right now.
Yeah, I'm sorry. It's about
Sorry.
to fast forward. Yeah,
Fast
so
forward, good.
with
Only
now,
veterinarians can get excited over.
Yes.
that's true. We tend to become happy when we see formed stools
Yes.
rather than wet stool.
Yes.
Yeah, so I'll proceed with the next case, which is Madiba with anal furunculosis. So what is anal furunculosis? It is an inflammatory condition wherein the anal sacs becomes impacted because of naihubag or inflammation on those tracts. So anal sacs, what are anal sacs? Oh, sorry, there's something that I forgot to. The anal sacs are two small pouches just located on the 4 o'clock and 8 o'clock positions of the. So how important anal sacs are? So anal sacs are lined usually with sweat glands, which produces foul smelling odor, and this foul smelling odor is the cause of gives this their territorial this access territorial markers. That's why you see dogs when you try to walk your dog, they smell on one another's poop, right? Dog
Or
ID.
yeah, when you bring your pet to a local mall, especially here in Cebu, where there's a pet-friendly mall, Park Mall, or in Robinson's Galleria, if they see other dog, what they do is that they do not lick each other in the mouth or in the face, but they smell each other's anus, sa ilahang lubot. That's one way of identifying that dog. For their poop has a specific smell, and that smell is from the anal glands. This anal glands, if we look at it, no, we cannot. That's really not that obvious if you look at your pet, unless if it's dilated or if it's open. And in normal pets, they are not dilated, they are not open, they are not swollen, they are just almost hidden in their anus, right beside. Nanay duha din ha. Okay.
Yeah, and with this secretions, doc, actually, just for an aha for everyone, for the viewers, the anal sacs secretion should be evacuated at least once a month.
Yes,
Um,
for small breed, once a month or once every 3 months, depending.
yeah,
Oh,
so
Dokama, one thing that we need to remind them, what are the anal glands? Kanining if they're impacted or if they're very full, once you touch that part no sa ilahang lubot in their butt, there's this specific pungent smell that will last for 3 weeks to one
yeah,
week, regardless of how well you wash it. That's from the anal gland. Or sometimes when they get too nervous, they would spray that, especially kung daghan kaayo. So that's also from the anal gland. Okay.
yeah, it turns out to be like a perfume for the rest of the days.
That's a very sad perfume for most
Yeah,
veterinarians who would
that's true,
take the
doc.
temperature, no, or the assistance.
Yeah, so I think going back to the case, Yeah, so this dog is Madiba again, with a 6-year-old spayed. It's been fed with low quality food, and it's been scooting as well. Scooting is like this is like when the dog,
Magkaskas.
yes, magkaskas siya sa iyang butt sa something rough surface just because of itch, no. So
Mm-hmm.
this is really very itchy, and sometimes with the dog would with this case the dog was crying when defecating, and then has been leaking on the wound. And yeah, and one thing with this case is I've noticed that there are skin lesions on the on the
Lips.
on the lips. Yeah, the tail was always pointed downward. This is due to the pain as well. So yeah, going to the case, you can see that this is the anus. Sorry for this again, and we can see wounds on the side. These are open tracks. This is what we call the anal furunculosis. So this is the inflammatory condition that happened with anal sacs, and this is the sequela of this type of disease. So this has been treated with diet change, probiotics, and anti-inflammatory drugs. These were the recommended ones that I had. I preferably use the ZD. Sorry for mentioning, but yeah, it really helped a lot with the case.
That's what
So
you gave Doc Gams, na?
yes, doc, this heals. But you can also use hypo. We can also use hypoallergenic. It depends on the case though.
Yes.
So this, yeah. So results of the treatment. So you can see remarkable changes. So after 7 days, you can see that the lesions. I mean, the margins of the wound has has now slowly healed, and eventually after on the day 14, day 21st, and day 28, you can see that it's now completely healed. Yeah,
Exciting to be
yeah,
veterinarians.
that's true.
We are always happy about the poop, the wound healing, the those that are not normal for other people.
Yeah, so so yeah, we really are very happy when we see our patients being
Recover.
recovered, having recovered. So yeah, and also with this case, we have noticed that the lower with the change of the diet, the lower lip lesions have also regressed, or it's gone, and then making it diagnostic for possible food allergy dermatitis.
Wow.
Then yeah. So I'll proceed with the next case, doc. So this patient, this is Fines, which has been brought here for dental prophylaxis, but sadly, when we did our dental prophylaxis screening, the dog was not fit for the procedure due to the increasing values of the liver values. So
Okay.
with
Doc Gams,
yes, doc.
this is also one of the reasons why we do pre-screening before any surgical procedure.
Yes.
So we make sure that your pets are safe to undergo the anesthetic. Okay.
Yeah. Yes, doc. So with this case, doc, after we did the liver tonic treatment and also diet change with either of this food, the ALT values has become normal already, making it suitable for the dog to undergo the procedure, since anesthesia will usually be metabolized in the liver. So I have another photo here. So this is the periodontal disease, grade 3 periodontal disease in dogs, in this particular patient, Finesse. So you can see the starter build up here with a little bit of gingivitis, and the after dental cleaning, you can see that the, the, the dental plaques are already gone. Yeah, so with,
Dr. Gams,
yes, doc.
yeah. It's also nice to remind our clients that how do we see this one? It's quite easy now. All we recommend you to do is open the mouth, the flap of your dogs, and check their teeth, especially on the side part. No, because this is where the build up usually occurs. The front part might be clean, but then it's always the insides.
Yeah.
This one, even with extreme brushing, this will not come off because these are already calculi or bato-bato. This will need dental cleaning. Okay?
Mm-mm. Yeah, dental health is really very important considering it's often neglected. So, brushing the teeth can also help. I hope the viewers are also starting to brush their dog's teeth or even their cat's teeth as well. with the right toothpaste too. So yeah, for dental cases, usually with after the dental procedure, we would recommend this type of food. This was mentioned a while back by Dr. Ivy and Dr. Gills to the previous presentation. So one thing that's good with the big surprise for this one is that later on, if you'll answer the questions that we'll be asking, you will get this. The one of the viewers that can answer can get a free 2 kilogram bag coming from Animal Wellness Dumaguete. Yay!
Very generous of our Dumaguete branch. They are the only ones giving this dental diet. So if during the question and answer for all of our viewers from Dumaguete, you may answer so that you win the dental diet. A 2 kilogram bag, right, Dr. Gama?
Yes, Doc. They can surely get this once they answer. And then another thing is they can also get this once they answer another question. They can also get this free
Tail food.
pail dog food pail, which is
Yes.
really very big, and it has also a free dog food scooper.
So
So
they
later
have good.
on,
Okay.
yeah, which is good.
Okay, so also for Dumaguete clients, but for our Robinson's Galleria branch, we're also very lucky because Royal Canin will actually sponsor, ano lang no, picture, an indoor cat diet. And then they have also given us other food that we can give on our succeeding discussions as well. Okay, continue, Dr. Cams.
Yeah, see, yeah. Okay, doc. So here, you and also for your dental prevention of periodontal disease, you can also provide dentastics or any dental treats. But however, with this type of again, these are considered treats. So treats can also lead to dietary discretion. So you have to be very careful. Then
Dr. Gams, we need to remind our audience also that if you give treats and then dog food, the amount of dog food that is specific for your dog will also lessen as you increase the number of the treats that you give. Okay, so that your pet will not increase in size too much.
yes.
Okay.
Yeah, so better be careful with everything that you give. Yeah, so with our next case, my last case, by the way, this is a body with stage 2 chronic kidney disease. Was presented with less appetite for almost a week with increased water intake, and um, the dog was brought here for screening. I mean, for laboratory tests to check the kidney function. We have this SDMA test, which will help us determine, which is highly specific for kidney function. And it turns out on the first visit, um, the dog's blood results were a bit high. And then on the next succeeding follow-ups, you can see that the values have turned out normal with the help of this diet. So with this case, I chose this KD Hills diet, but we can also use renal. Um, it depends on the preference as well. And then later on, 3 months after, when they came back with the same presenting complaints, um, the values of the SMA has increased again. This is because the dog, maybe the owner is already like confident enough to return the dog to its usual diet. So the most important one thing that I've learned with this one is that they call this it's really these prescription diets are really very important, especially with this chronic kidney disease, because this is a type of degenerative disease. Like we say, degenerative disease, it starts with um, a smaller problem, and then it gets bigger. So with this kidney diet change, we can slow the progress of this disease. Yeah. So
Yeah, and one thing also about the kidney is that once it's affected, the effect will be there. It will not regenerate again. We will remind you again that prescription diet does not mean that it's a medication. It only means that it is like complementary to the medications that we give, and it helps hasten or improve that specific condition of our pet. So when we give prescription diet, no, we cannot say na parang may liver problem, I'll give liver na. And then yung pala, when you bring your pet to veterinarian, your veterinarian realizes that there's a heart condition, there's a kidney condition, there's a liver condition. Now we need to actually give you a recommendation that is custom fit for your pet. Okay, what is custom fit? Sometimes if they have diarrhea and we just give immediately ID diet, but then that diarrhea is because of hypersensitivity, then we change the diet naman. So that is also always that is why we always ask for a prescription. For instance, you go to our clinic and buy a prescription diet, and the patient is not our patient, and we can't see the history. We ask a prescription from your veterinarian to make sure that you are actually feeding the right food for your pet. If they have been fed with that diet a year ago, they might not need it now. No, unless you have another blood result or your veterinarian has already assessed your pet properly. Okay.
Mhm. Yeah. So routine checking for kidney function is really very important. If you can as early as 4 years old, you can start having your dog checked for liver and kidney functions as well. So
Yeah.
that we will see. Yeah.
Dr. Gams, one thing nice about SDMA is that it's an earlier diagnostic tool. If we do the CREA and BUN, it's on the later side, basig na natay anong actual disease of the kidney. Well, with the
Mhm.
SDMA, that's the start of being the kidney being diseased, right, Dr. Gills? So,
Yes, STMA can detect 25% of kidney damage,
mhm.
while the classical BU and CREA can only detect above 80% of kidney
Mm.
damage. So early detection is very important, and regular testing, like Dr. Amma mentioned.
Yeah, it's very important.
So yeah, so I think that ends my presentation. But
Very,
as we
very
discussed,
thorough.
yeah, it's prescription diets are not just regular food, but are also part of the treatment.
Yeah,
Yeah.
very, very thorough, Dr. Gams.
Yeah.
We have some questions. Let's answer the questions first. Is Yakult safe for your pets? Yes, it is very safe for your pets. It may help. Once we give Yakult, it will help stabilize the gut of our pet. It will increase the good bacteria. So, but sometimes there are cases when the problem is because of worms or is because of a protozoa or bacterial infection that will need treatment. And definitely the Yakult is a good parang backup na, to help. There are also prebiotics and probiotics that are specific for pets. And
You have to remember also that you don't want to give the whole bottle in some dogs. You also have to adjust the dose because too much of a good thing is possible.
yeah,
We have another question.
we hope that answered your question, Michelle. Thank you so much for asking. My dog was diagnosed with pancreatitis last July. Since then, she's on a low-fat GI, gastrointestinal low-fat diet. What a dry wow. Social na. Well, will she be on a low-fat diet for the rest of her life, or can I shift her back to her usual diet, which is Royal Canin Dental Digest 25? So this is a nice question. Um, Most of the time, we give the low-fat diet as needed. But then if this continues to recur, then it might be a nice diet to continue. It depends on your veterinarian. But then if I were the one to check your pet, if she's already ready to go back to her diet, then why not? Not her regular diet. Well, what are your thoughts, Dr. Gills and Dr. Gams?
Well, when it comes to the GI low fat, if it's for pancreatitis, yes, definitely. But there are cases of irritable bowel syndrome wherein your dog might also be one of the symptoms is pancreatitis. It can recur and recur, and that's when your dog might need to be on the the special dog food for the rest of their life. The best thing would be to go back to your vet and get an opinion on whether or not you can take your dog off of the diet.
Yep. Okay.
This one,
The farting. And sometimes it smells worse than what we
yeah, they tend
expel.
to sting quite a lot. Yes,
Yeah.
especially in shorter snout breeds for some reason. Bulldogs and Boston Terriers, they tend to fart a lot and tends to be very, very smelly. And I don't know that any dog food will help with the fart.
Unless siguro if it's easily digestible. No. But then there's some dogs that sometimes again, if you don't fart, you're not normal. So
Yeah.
but if you hear a lot of borborygmus, what is borborygmus? When you listen to the stomach and you hear the okay, if you hear that frequently, then that might not be normal. So again, it's better to have them examined. Okay.
Yeah, so the biggest thing for for the flatulence, let's call it a medical term. So um, I would look into the probiotic and prebiotic. That has been shown to help a little bit with the smell, so to say.
Mhm. Ang difference pala between pre and probiotic, the probiotic, most of the time it's refrigerated and then you need to give for ang amount niya should be the same almost as the size of your pet. No, it should cover the entire gastrointestinal tract. While the prebiotic, you don't really need to refrigerate that, and then it's also not size dependent, so you don't need to give a lot. So sometimes when we give a lot of Yakult or a lot of the preparations na liquid, they might be so full. When we feed them, they don't want to eat anymore, and then we might be confused na murag hala, my dog is not eating. Yung pala busog lang, na?
Yeah,
So,
especially in the teacup breeds wherein they have diarrhea or vomiting. Be very careful on how much food and medicines you give because their stomach might not be big enough to handle everything.
yeah. So now I think it's now our turn to ask questions so that they can win the dental diet from our Dumaguete branch. So when you win this diet, please claim it from our Dumaguete. So this is specific for our Dumaguete viewers right now. And for our Cebu viewers, we also have a question and answer for you after. Go ahead, Doc Gams. Dr. Gams.
All right. So with my first question, this is going to be an
Doc
easy
Gams, what's the
question.
price?
I
The
hope you're
pail?
listening to. Yeah. The price will the
The
first
pail.
price will be
The
the
pail
pail.
for your
Yeah.
dog or
This
cat
one.
food. Yeah.
Yes, doc.
With the zipper.
Yes. Yes. So with our first question, here it goes. Animal Wellness Dumaguete is open daily from 9 a.m. to 6 p.m.
True or
True or
false?
false? So again, it's Animal Wellness Dumaguete is open daily for 9 a.m. to 6 p.m. Is it a true or a false?
Yes.
Open
Open
daily.
daily from 9 to 6 p.m., including Sundays. True. Wang Yu. Nako, Wang Yu will go to Dumaguete. Or Emily, true. True, true, true. Yes. So,
I
yes. So, Doc Gams, we're
is
giving
he
it to
considered?
Wang Yu. We'll visit Dumaguete, right, Wang?
So you pay a visit here, Sir Ongyu, and then we'll give you this mail. Don't forget to ask this from us too.
Yes, we are right across Nevas Pizza, very near Siliman University. So if you have relatives and friends from Dumaguete, you may refer them to our clinic. Okay. Pagams, do you have a second question or would you like me to ask a question for our Cebu viewers?
See, let's do. You asked the question, no? For the
Okay,
city
for our
viewers.
Cebu viewers, very nice. Okay, one question. Okay, the cats are A, obligate herbivore, B, obligate omnivore, C, obligate carnivore. So what is your answer? A, B, C. Cats are are herbivore. A, B. Are they omnivore? Can eat vegetables and meat. Or C. They are obligate carnivore. Okay, Christy, I love you, but we can give the prize to Emily Chung. Okay, so letter C. So what is our prize? Our prize is can you see this one? Royal Canin Indoor for cats that you can claim in our Robinson's Galleria branch. Where is that, Doc? Okay, our Robinson's Galleria branch is in basement 2. It's at the rightmost parking, but right now, Robinson's Galleria closed their basement 2. So the nearest entrance is entrance 1G, and then you can take the escalator one flight down. Okay, so yes, cats are definitely obligate carnivore, and if you look at their teeth, you can really see that all the teeth are um, sharp. Okay, Doc, Doc Gams. Wow, I noticed Doc Gams that we have more Cebuano watchers. Or if not that, our Dumaguete watchers are basig shy and timid ba? Uy, nawala si Doc Gams.
So we have viewers from Dipolog, from
Wow,
Manawa.
and now, how nice. While we're waiting for Doc Gama, you can also tell us more where you're from. Wow, Wang Yu is now in the Polog. Wala day ka sa Cebuang. Okay. Yeah. And then,
So our take home message. Dumaguete.
wow, Emily is from Dumaguete. Emily, would you like us to, wait lang ha, paano kaya yan? Can you come over to Cebu? Because that question is for, okay, wow, peanut and butters. You're in Singapore right now, o, 'di ba? Wow, amazing. Thank you so much for spending time with us. What happened to Dr. Gama, Doc Gils? From Cebu.
Hi,
Salamat.
Doc.
Doc Gams,
I'm
Emily.
back.
Emily is from Dumaguete, but the prize that she won is here in Cebu. Naloko na.
maybe
Yeah. So,
maybe
Doc
we
Gams,
can.
swap.
Yes, Doc. Let's do a swap.
Wow. So,
So she will be getting this free dental bag.
wow, kaswerte. This is exclusively sponsored by our Dumaguete branch. They're very generous.
Emily has a cat in Cebu. So
Emily has a cat in Cebu?
yes.
Wait. So, pounds, Emily can only win once so that we can also give chance to others. So, Emily, you
So it's
choose.
fine. Yes, she was the first to answer, and she says it's fine, so she gets the prize.
Okay, sorry. So, Emily will get it from Cebu Doc Dam. So, the dental diet is still available for our
Oh.
Dumaguete
Right.
viewers. Okay. Tama? I know. No, sorry. Doc, yes, can you flash that one? Yay, I'll get it in Dumaguete. So Emily will get her prize from Dumaguete, which is a dental diet. So it only means that our indoor cat diet is still open for our Cebu viewers. Right, Dr. Gams?
Yes,
Right?
Doc.
Okay, so again, this is the prize, and you will get it for our Robinson's Galleria branch. Doc Dam, since I asked the question for this one, but then it became by Emily that you will win the dental diet there in Dumaguete. Do you want to ask a question? But they will claim it here in Cebu. Okay.
Mm, can you just ask it, Doc?
Ako na lang di ay what
I,
would
I,
like
I,
the question? Sige, since we are discussing about cats, what is this supplement that our cat needs in their diet that they cannot get in just simply feeding them the regular fish food, seafood diet at home?
Amino acid.
Yeah, what type of amino acid do we need to add to their food? Okay, A, folic acid, B, taurine, C, tocopherol. A, Okay. Medyo difficult to, no? But it's really important. And they get this from cat food. But if you do not want them, wow, we have a viewer from China. Hello, Martha.
China, all the
Wow,
way.
that's really far. Okay. So, if you want your cat to be healthy, they need this for the development of their eyes, their heart, their cells. No, we need to add um, A, folic acid ba? B, taurine. They need it ba? Or C, tocopherol, vitamin E.
We already have a correct answer.
Wow. Okay, so thank you. We also have a viewer from Singapore, Lay. Oh, wait. Ooh,
Dandy.
Dandy. Dandy. Just one dandy every 2 weeks. Thank you so much for watching all the time. Dandy, really watch as well. And yes, it's taurine that they need. So you may claim your prize from Robinson's Galleria branch. The nearest entrance is entrance 1G and just take the escalator down. No? And then if you also want to set an appointment for any of our branches, please give our branches a call so that they can set your appointment. It's special, especially right now. We do not really recommend the walk-in because we need to make sure that there is social distance inside our branches, and at the same time, we don't want you crowding over, no, during that time. So we'll be giving you a specific time so that you can be attended as soon as our veterinarian is available. Okay. Do you have any words, the caps for our viewers before we leave? Oh no, we still have a take-home message pala, no, Dr. Gills?
Yes.
We forgot pa naman.
Yes. So the biggest thing is to talk to your veterinarian. Make sure that you tell them your concerns, tell them what's troubling you, whether it be the farting, whether it be the anal glands, whether it be the wet poop, or if your dog is eating too much. Your vet can help with all of these problems. So you want to buy the best pet food you can afford. Again, quality comes with price. You get what you pay for. Most commercial foods are good quality. It's just that some may suit your pet better, depending on the topics that we discussed. Now, the age, activity,
The
and
size.
the size. Prescription diets are part of the treatment. You have to consider them as part of the treatment. Now, we'd like to thank everybody who participated in the discussion. Always very interesting to get to see where everybody's from and the concerns. Thank you, Doc Gama. Would you like to say some
Parting.
parting words?
Yeah, thank you so much also Doc, for inviting me to join this lively pet talk. Is it called a pet talk?
Yes.
Yeah. And then yeah, with our branch, Dumaguete branch is located in Hibard Avenue, Piapi, Dumaguete City. You can call us for appointments, and then you can look for our numbers in our animal wellness page. And then we are open Mondays to Sundays. So please, you can come and then just call us for an appointment. I think that's it.
Even Sundays, right, Dr. Gans?
Yes, doc. Even on
Yeah.
Sundays.
Especially if you're busy on a weekday, you can always go visit on a Sunday. Okay. We should have posted. Doc Gams, can you just tell us the phone number, the easiest phone number that they can call in Dumaguete?
Oh yeah, so I can. Our phone number is 09. Our phone number is 0917 708 6967. And then
Okay.
for our landline, and landline number is 035
Thank you, Dr. Gama. Okay, so Emily, thank you, and you'll get your prize from Dumaguete as well as Wangyu. And for Dandy, you can get your prize from Robinson's Galleria Cebu, which is also open from 10 a.m. to 7 p.m. Again, we would recommend for everybody to call us for an appointment before visiting so that we can attend to your pets and so that you don't need to wait for a long time and we can be sure that we can minimize the spread of COVID-19. Okay, thank you. And hope to see you again. I think next week we'll have one of the pet education of part 1.
Yes. Thank you, everybody. It's always
A
a
pleasure.
pleasure. Till the next one.
Bye bye.
Bye.